University officials note the Tempe patient is not severely ill and is in isolation to keep the illness from spreading, but people are still worried. ASU students petitioned unsuccessfully to get classes canceled, and some local stores report running out of hand sanitizer and masks.
A lot of kids, students, and faculty and staff are wearing more masks because of the alert that they sent out.
That alert went out Sunday, announcing the first confirmed case of coronavirus in Arizona and the 5th so far in the U.S. In all 5 cases, the patients had traveled to Wuhan, China, the epicenter of the outbreak. Federal health officials note there have been no person-to-person spread detected here in the U.S., but Arizona residents are still being careful.
Some classmates of mine have avoided classes or have gone to classes like wearing gloves or wearing like a mask because they're afraid of the virus to get contaminated and to not be able to continue their education.
Despite all the worries, experts say the likelihood of contracting the virus is not as great as getting sick with something more common.
Much more likely this time of year, and with everything going on in our community, is influenza, which we're having a really big year. Arizona, we're up to close to 1,000 cases, which is about 3 times what we usually have by this time in the year. So, I would really say be vigilant for fever and cough anytime. Seek medical attention, but understand that it's much more likely to be one of our routine respiratory problems like influenza rather than a coronavirus.
Public officials recommend following basic prevention guidelines to avoid contracting any respiratory disease. Live in the broadcast center, Isabella Hulsizer, Cronkite News.